Awesome. Welcome, everybody. My name is Nick Hall from the Mental Health Coach. It's my absolute pleasure to welcome you along to today's session. Before we get started, I'd like to acknowledge the traditional owners of the lands on which we're all meeting today and pay respects to elders past, present, and emerging. And of course, pay our respects to any elders that might be here with us today. It'll probably be no surprise to you that today's content focuses around a theme of mental health, which I'll show you shortly. And I think given that we're in a post-referendum space, that it's really important to pause and reflect here and acknowledge the country that we're all on. Our Indigenous and First Nations peoples are really going through it from a mental health perspective at the moment. And I think it's really important always to acknowledge, but perhaps a little bit more so at the moment. The other acknowledgement I'd like to do is to acknowledge lived experience. I know based on who's on the line that we have some lived experience around mental health in the room, and I want to acknowledge that. It's a real superpower when we use it in the right way, and our project that we're going to reveal to you today is probably a good testament to that. But welcome along. We acknowledge all of the lived experience that's here today. So our warm welcome, Wamanjeka or Kia ora to you. Who you've got on the line today is myself from the Mental Health Coach. We're joined also by Catherine Epsom, our special guest. Hi, Kat. And we have Matthew here as well from the Mental Health Coach too. Yeah, that's who you've got today. We're going to jump into it. We're going to be talking about mental health today, and that can be tricky sometimes. It really can. You might like to screenshot this screen or take a photo of this screen with these support numbers on the left-hand side. If you need those today, feel free to reach out to those supports. We're all about that, of course. And Matt is also here for you as well. If you need support today, please reach out to Matt in the chat box or the Q&A box, and Matt will connect with you and support you. We are going to be focusing on suicide prevention today, and we'll be talking about suicide quite a bit. So we encourage you to look after yourselves as we go through the content today. There's no problem in reaching out for support. We strongly encourage you to do that, and we are all here for you if that is what you need. We follow the mind frame guidelines by Everymind when we talk about sensitive topics, including suicide, and that includes avoiding graphic details of descriptions of things. So just so you know, we're going to talk about suicide and mental health more generally, but in a very safe kind of way. So today, I just want to introduce you. You may not know much about the Mental Health Coach, so I thought I'd just introduce what we do. So my name's Nick Hall. I am the founder and CEO of the Mental Health Coach, and primarily what we do is mental health awareness training. So we do mental health first aid training, we do suicide alertness training, safe talk training, workshops, one-to-one counselling kind of work, all of this sort of stuff. And we work with everybody from year 7 students upwards. So we work in high schools, we work in communities, and we do a lot of contextualized programs as well. So we're very much about supporting mental health and wellbeing in a range of different ways, in a range of different settings. And this work takes us across the country. We operate online across the whole of Australia, and every now and then we do something in New Zealand. So, we work all around the place. But our focus really is on giving people skills, giving people knowledge and skills to support their own or other people's mental health journeys. As I've done that work over the last little while, I do meet lots of different people. I go into lots of different organizations and I work with lots of different communities. And no matter where I go across Australia, one message is very clear. And that message is that suicide's still common and that the impacts on communities are enormous. They're huge. I don't think I go a week without hearing someone tell me a story about how suicide has affected them. And I feel privileged to hear those stories because, it takes a lot of trust to do that. But I also feel a bit of responsibility there, to try and help more. And I wanted to do that for a very long time. And what we've been working on over the last little while is a way that we will actually work towards doing just that. So we are facing a significant challenge in Australia, the pressing issue of suicide. It's a big challenge in Australia, and we've actually just got new data. So we have new data that's been released. So the ABS has released their cause of death data from 2023, and it reveals a fairly sobering picture. These numbers have stayed stubbornly consistent over the last few years. So suicide is not going up necessarily or down, it's just kind of staying the same. In Australia, it's about 9 people every day who lose their life to suicide, and that amounts to about 3,500-ish people every year. That's 11.8 people per 100,000 in the population. So we also know that around that 9 people, around each of those 9 people, each of those deaths actually directly affects about 140 people. So when we do the maths, it's a big problem. It's a really large problem. And as I said before, as I go around and I work with communities and I work with organizations, I'm hearing that story a lot. And so I hear it and I know it. And it's also backed up in the data. So in 2023, we lost in Australia 3,214 lives to suicide. We know that 75%-ish of those deaths are men. We know that 82.5% of those who lost their lives to suicide were under 65. We know that suicide is the leading cause of loss of life for Australians between 15 to 44. And we know that it actually causes a loss of life of about 35 years for men and about 37 years for women. These are lives lost too early to suicide, and there's a need to address this, right? It's not going away. That's one of the challenges. For the first time this year, the data actually looked at geography, looked at location, and where you live in Australia makes a huge difference. So, for the 5 year period between 2019 and 2023, the suicide rate in rural and remote Australia was consistently higher than in both regional and metro major areas. So, this tells us that this problem is more prevalent in those areas. It's a big problem in metro areas too, but it's a big problem in those regional and rural areas too, because there's also a lack of services. So when someone in those regions finds themselves in a situation where suicide is affecting them, they have a shortage of resources, and this all kind of increases the risks. So the stat here says many remote areas experience more than double the rate compared to men in major cities. So these stats kind of tell us the story about geography and about prevalence. We also know that for Indigenous Australians, suicide rates continue to rise for our Aboriginal and Torres Strait Islander people. In 2023, the suicide rate amongst Indigenous Australians reached 1.8 per 100,000, which is more than double that of non-Indigenous Australians, with 275 lives lost this year alone. Further to that, suicide is the leading cause of death amongst Aboriginal children. The data tells us what we already know, that suicide is a major problem in Australia. It's a big issue. Suicide also has this ripple effect to it, what we call the ripple effect. So if we think about each of those lives lost, each one of those lives lost affects directly 140 people. Now, when we do the maths and we say 9 people per day times 140 people affected, that means that 460,000 people per year. Let's round that out to be 500,000, because we know more people die by suicide than the stats actually collect. And we can see the immediacy of the problem. In a country our size, you won't have to go too far down your chain of connections, your connections through friends, family, workplaces, communities, to bump into somebody who's been affected by suicide in the last 12 months. It is a lot closer to us than it feels, I think. And again, the data shows us this story. Now, our focus around this project that we're working on is that within those 140 people that are directly affected by suicide, there are 8 of those who go on to live life with an increased risk of suicide themselves. So within this bubble, within this ripple that happens around a person, there is heightened risk simply by being connected to that person. And the project we're working on can be seen as preventative and postvention, but actually it's even more than that. Yeah, it's even more than that. But here's the story. Each of these lives that are lost causes a ripple of blame, anger, guilt, and sadness around them. The people that are left behind, those 140, all experience these key primary emotions in different ways, of course. Everyone's different, but they all experience this. And all of these things, if you've done mental health first aid with me, you know how much I love the mental health continuum. All of these things push people down into the red zone, where they are depleted, where the risk for developing mental health problems, the risk for developing or experiencing suicidal thought is much higher. So this ripple brings blame, anger, guilt, and sadness to the person, and that by itself pushes people down into that red or the orange zone. And this is risky. This is risky for people. We know that the longer we spend down here, the more risk there is that we go on to develop a mental illness. So supporting someone who's experiencing these emotions can be very challenging. And as a family member, a friend, or a colleague, it can be incredibly difficult to work out how to support someone through that experience. One thing we know for sure is that no one should face suicide alone. And that's where we're focusing on. And that's why I'd like to introduce you to our new project. Our new project is called AfterBAGS, and I have a little video to explain it to you. So, folks, I'd like to introduce you to the AfterBAGS project. I'd like to introduce Catherine Epsom to the call. Catherine's going to tell you a little bit about the story that's brought us to this point of being able to share with you the AfterBAGS project.
Thank you very much, Nick, and hi everybody. Thank you for being here today. This is quite a big moment for us all on the call. We've been working on this for some time. And yeah, so I'm feeling a little bit nervous and vulnerable, but I wanted to share this story of how this project came to be and also how I met Nick and came to work on it with him and Matt. So yes, I'm Catherine Epsom. I'm the co-founder of the AfterBAGS project. Any of you know Nick would agree that he brings so much experience, knowledge, and empathy to this kind of work. I have the sad but purposeful role of bringing lived experience um, to this project, as I am someone who was closely bereaved by suicide. So the picture that you can see on screen at the moment is my husband Darren and myself, who's Darren's on the call, I think. My mum, my dad, and myself, and we're in Harndorf, South Australia, having an absolute blast. As you can see, we've got the steins on the go. Only a few years later, and in June, just last year, actually, we lost Dad to suicide at the age of 73. My dad was my absolute rock. He was so similar to me. He was an anchor in my life, and every day is more difficult without him being here. It's probably fair to say there's no good way to lose a loved one, but if I try and explain a little bit about what it felt like to lose Dad in this way, the only way I can describe it is complete numbness, disbelief, doesn't feel real, and it's just too much for the human brain to process. Um, so there's many things that it's difficult to comprehend. Um, there's many things, there's many facts that you search for after something like this happens. And at some point, all of this muddle and shock and confusion gives way to some of those emotions we were talking about earlier: the blame, the anger, the guilt, and the sadness. And some of you may have noticed that that actually spells bags. So there is a connection to what we are doing here. So if I tell a little bit more about the story of how After Bags came to be about, after we got the news about Dad, I somehow managed to get myself back to the UK. Very difficult journey. Mum and I needed a lot of immediate professional support, and that came in the form of an organisation called Rethink Mental Illness, who specialise in supporting those who've been bereaved by suicide. And I can honestly say that I don't think we would have got through this experience or come through it. We would have, but not the way we did, without that organisation and my wonderful support worker called Annabelle, who really helped myself and my mum through those early days of just anger, of feeling ashamed of those thoughts, being speechless, being frozen by despair. And through Annabelle, I received what became the inspiration for the AfterBAG, which was a really beautiful care package specifically for those bereaved by suicide. Very similar in contents to what we have created in the AfterBAG over here. So there was a grief journal, a candle, some chocolate, tea, tissues, lip balm, and each of those had a thoughtful connection to why they're important after a complex loss. So that might be to remind you of your self-care, that it's okay to cry, that you to talk to someone over a hot drink, and so on. If I just talk a little bit about the UK story. So the UK bags have been created by a lady called Angela Allen. I always think about Angela's story, and it's a difficult one to hear, but it really does sum up what an afterbag is about in very difficult, tragic circumstances. So Angela lost her daughter to suicide, again, completely unexpectedly, the same as with Dad. And while dealing with this absolute horror as a family, it became simply too much for her husband to process, and he took his own life 7 months later. So she lost two people in her immediate family in close proximity. When we talk about the ripple effect, sadly, that was a horrible, real example of that. Angela was at the hospital for the second time immediately after losing her husband, and a policeman wanted to take a statement or do some kind of paperwork, and he said to her, "Well, you've been here before, you know what to do," which is just absolutely shocking, but a symptom of not many people knowing how to confront a situation when suicide is involved or awkwardly navigating the words. So when I was looking at bringing something similar to Angela's bags to Australia, we spoke on Zoom, and she told me that she created these bags so that no one ever needed to have an interaction like that again. So it can be very difficult to find the right words to say to someone when they've experienced this kind of loss. And it often leads to all kinds of unintentionally unhelpful or damaging things being said. So Angela now distributes her bags through many channels. So that includes the police, so that when there really are no words, they can be handed over or sent out with an "I'm so sorry that this has happened to you" or similar sentiment. So just to sort of finish off the story about how AfterBAGS came to be, with my own experience of receiving a bag, was it made me feel so much less like I was alone. So suicide can be incredibly isolating for those bereaved by it. It's confronting. Sadly, there's still some stigma around the topic. People aren't necessarily comfortable sharing what's happened. And what this means is that often you become at greater risk of becoming deeply and dangerously distressed. So going into that red zone themselves. For Mum and me, just knowing that we weren't alone, we were being thought of, not to mention the practical and comforting nature of the contents, it was just huge. And I think it made the difference between just feeling completely hopeless and in despair to starting us on that healing journey because others had come before us. The journal we received was a safe place that helped me to sort through some of the muddle of that blame, anger, guilt, and sadness. And it was hard to write the words on the page, but journaling and using those guiding prompts to capture some of those complexities of the grief and then working with a therapist on them was just so immensely helpful. So that's how I met Nick, and AfterBAGS came to be. I came back to Australia after two very quick UK trips in succession. And it was really important to find ways to honour Dad's memory and contribute to suicide prevention. Mental health first aid in my workplace was something I felt I could do immediately, and so I was introduced to Nick through a mutual colleague. And we talked about the bags. I showed Nick the bag I had received from Angela and asked if he knew of anything similar. We both did some research and we don't believe that there is anything, so we created it. So I'll probably close there because I think I've probably talked for a little bit longer than I planned to, but it is an important thing for hopefully to bring some understanding of how I experienced what we have created and the difference it made. I finished by just saying we're so grateful for all of your support, for everyone that's here today, as we move it from being an idea and something that was only real in the UK to being something that we do hope can help those impacted by suicide in Australia. Thank you. I'll pass back to Nick.
Thanks so much, Kat, for your sharing your story with everyone. It's a story I've heard a few times over the last year or so, but yeah, every time I hear it, I hear a little bit of something new, and it just connects through to what we've been working on so much. So yeah, thank you for, and it's a important thing that we share these stories. Actually, when we think about suicide and suicide prevention, it's a really important thing that we share these stories. So thank you for doing that. I want to show you now a little bit about the detail of the project. So we're framing this up as a project, and we have a few goals. Our top two goals, I suppose, is to partner with communities, charities, workplaces around Australia to support those people affected by suicide loss. And our primary goal, I guess, is to provide that sense of comfort and connection and empathy and care that Kat explained, that was so useful for her and her family in that time. And we want to make sure that people, when they are bereaved in this way, they feel seen and understood. And hopefully that translates into feeling safer, having less negative experience around this stuff, feeling connected. And the way we intend to do that is by distributing AfterBAGs to people who need them in a free or low cost model. This will also help us to fund free or low cost suicide alertness training in communities that need it anywhere in the country. So when we think about mental health training, mental health alertness, suicide alertness. This project is squarely focused on providing support to people who need it and extending that support onto a community level. And we intend to do this with a partnership model. This is, you would have seen in the video a bit of a snapshot, but this is our version one, as we're framing it, of the AfterBAG and the products that are inside. These have all been hand selected by Kat and I, physically, literally hand selected by us. And in a very nice kind of way, nearly every single item in this bag comes from a supplier who either has a direct experience themselves, we've connected with an employee at a supplier who has a direct experience of suicide themselves. So these products are not only intended to be supportive for the person receiving them, but also, you know, we're already hearing stories from people who supply these products to us about how useful they find this project already, and we haven't distributed any AfterBAGs yet. So these are really thoughtful items, and they have this sort of depth of connection to the cause. You'll see that it's got the journal and it has a list of support services. It also comes with a bit of an explanatory document that explains why each of those items are in there and how that might help them through that aftermath of blame, anger, guilt, and sadness. It also includes the journal. So we took inspiration from the journal in the UK, the After Journal in the UK, and yeah, the author of that journal was very supportive of us using her journal as a basis. So we've reimagined it and we've made it into an Australian context. Kat and I wrote this, and Matt, who's on the line with us today, designed and laid it out. It's a beautiful, beautiful hand. It's a physical document. It's an actual book, and I was planning to have one to show you today, but I don't. But yeah, it's a physical book. It's a beautiful document, and it's designed to help people navigate that process of navigating through the blame, anger, guilt, and sadness, and a place for them to not only capture their thoughts and help them process and to connect with a professional in that way, but also in a very nice way to collect memories of the person, so that they can keep this document for a period of time and look back at it in the future as a way to remember their person after blame, anger, guilt, and sadness. Once blame, anger, guilt, and sadness have subsided a little bit, or perhaps when life has expanded around those things. And this is our kind of concept behind the name. We believe that there is a time for people after blame, anger, guilt, and sadness. So you might be thinking, how can you get involved? We would love all kinds of involvement. We've been working on this for a long time, and today is the first moment that we share it with the world. So we're open to all sorts of ideas. But initially, we think that a good way to get involved is to, if you know someone who needs an AfterBAG, who's been through this experience, you can send one to them. You can also pay it forward. So if you don't know someone who needs this product, you can pay it forward, and we will work with our network of charities around the country and organizations around the country to make sure that AfterBAGs get into the hands of people that need them. You can also contribute to the project, and there's a range of ways that you can do that on our website. You might also like to sponsor a number of bags for a community or for an organization, and we can help you with that. You can also register with us. If you're an organization that works with people who are bereaved by suicide loss, you can register with us, and we will have a relationship with you where we make sure that your community gets the bags that they need. That's and look, we're also open to other ideas. If you've got an idea about how we could work together, let's chat about it. We are really serious when we say we're going after this number. We want this number of suicides to reduce, particularly for those left behind, and we're very open to all sorts of ideas about how that could happen. So we have a website, afterbagsaustralia.com.au. We have an Instagram presence as well. We've also created a GoFundMe campaign. So that GoFundMe campaign is live now. That $5,000 goal will fund 110 AfterBAGs, which we will again work with our community and charity partners to make sure that they get to where they need to go. You can scan that QR code there to find the GoFundMe. Also, you can just search for AfterBAGs on the GoFundMe website. Any contribution makes a big difference to people. So that's the AfterBAGS project. We would love to open the floor to questions, thoughts, feedback, anything of the sort. We're very open to ideas and thinkings and all of those sorts of things. And now is the time and the space for that. So I might just pause here for a second to let everybody have a bit of a think. And of course, if you are feeling overwhelmed or the content has been upsetting for you, we are here right here for you. Matt's here ready to support you on the Zoom platform. Or, of course, please reach out to any of these support services. Lifeline can be reached on 13 11 14, Suicide Callback Service on 1300 659 467, and Grief Line 1300 845 745. You can also scan that QR code to head to the website. We have a downloadable A4 sheet of resources and phone numbers that are very handy, so you can scan that code or head to that website. Matt's just put the website into the chat box as well. So yeah, I'll pause here for a second. Let us all kind of have a bit of a think, and yeah, feel free to send through your questions, all that sort of thing. Go for it, Kat.
I just thought I'd raise my hand up for that.
Yeah.
I can't actually reply on the chat, but I just wanted to say a massive thank you for all the beautiful messages that are coming through of not only of support for the bags, but of the story sharing. It's not an easy thing to do, but it's a worthwhile thing to do. So yeah, I really appreciate everyone saying, but yeah, thank you for doing that. So
Yeah. There's real power in sharing these stories, folks. You know, there's real power in sharing what we go through and how it affects people. I think it helps us to be alert to this possibility. It helps us to be alert and ready to respond. And that stuff in this space makes a massive difference. And it's no exaggeration to say that that can be life-saving. It can be life-saving. Yeah, absolutely. Yes, I'm just scrolling the chat box as well. Lots of comments about how it's a great concept, and thank you for sharing your story, Kat, which is amazing. Yeah, I'm just having a bit of a read through. Yeah, oh, thank you, Kat. That's a really lovely comment. Thanks, Brooke. Hi, Brooke. Thanks, Felicity. Chris, lovely, amazing. Thank you. Yeah, lots of lovely thoughts coming through. So questions. Are we looking for more items for the bags? Like if someone here has a business connection in the community, could those items be added to the website for purchase addition to the bag? Yeah, absolutely. Yes, if you are someone who has items that you think would be worthwhile and relevant and suitable for the bag, we'd love to hear from you. This project will work best in a collaborative model. So, we've kind of worked in our team to bring this to where it is right now, but we're absolutely open to collaborating, sharing, and working together. So yes, absolutely. If you have ideas about that, feel free to you can reply to the email I've sent you, or you can jump onto the website and get in touch with us. We'd love to talk to you about that. Absolutely. Diane says, any ideas on how to break the stigma of suicide discussions in the workplace? Yeah, I have lots of ideas about that. That's the work that I do mostly, Diane. So I go into workplaces all the time to educate people in mental health first aid or safe talk suicide alertness training. And in that process, we do find that the stigma does drop. And usually the stigma, and this is not the case all the time, but I find a lot of the time the stigma is not so much the issue. The stigma, we all kind of understand the issue, but the blockage is we see it or we sense it. We sense that suicide might be present, and then we get a bit stuck on what we do next. And it gets expressed that way as a lack of help seeking or a lack of help provision that feels like stigma. But I think it's actually giving people the tools and the skills to actually have those conversations. So I know there's people on the line who've done mental health first aid with me. I mean, Kat, we did mental health with your team. Maybe you can have a chat of, make a comment about that.
Yeah, well, I mean, if I speak from the perspective of the training, um, it's such an interesting one because it is such, you feel it in the room, you feel the difficulty of the conversation in the room. However, so many people in our group said just the opportunity to have a safe forum to be able to talk about it and even use the word. And I felt that after Dad, it took me a long time to even be able to say the word out loud, but it's a real thing. It happens to real people. There's a lot of it, and I think it's on all of us really to just be brave enough to not shy away from the conversations as they come up, and just gradually move that dial. So um, yeah, I don't have the answer, but I do feel like we all have a role to play in just making people just more aware that it is so very out there. We
Yeah.
shouldn't be hiding from it, and it's not a wrong thing. It generally comes from a place of deep mental unwellness. So yeah.
Be at any time, right? I think sometimes as well we do worry about teaching people about these things, and we worry about the impact it'll have on people. And certainly that was a consideration when I worked with Kat's team. Here I was going into a team where Kat had, lost someone quite recently, but the way we do it allows people to feel safe and supported and learning at their own pace about these things. And in my experience, when I present information about suicide or any kind of mental health topic, really, people sit there and they go, I knew about it, but what I didn't know was how to help someone, what to do, what's the action I take. And so we teach them, we show them, and it's very safe and it's a very sort of empowering process to actually teach people that stuff. And it's a very safe. So if that's the need that you have in your workplace, then the training that we do now through the mental health coach, a portion of all of those training fees will go to funding more AfterBAGS. So it's a real connection through to the work that I do already, and I'd be very happy to talk to anyone about running mental health training in your workplace or your community. Sarah says, any guidance around how we can help you amplify what you're doing via our own personal networks? What a great question. Thank you. At this stage, it's probably just sharing with people, sharing the ideas, sharing the website, maybe jumping on the Instagram account and following us there and sharing some of that content. That would be very useful. You can go onto the AfterBAGS website and buy individual products as well. So if you don't have someone that needs a bag, but you want a really nice stress ball, they're very good. Everyone loves them. Um, jump on and do that. Or if you want to send someone some bath salts for Christmas, you can do that too. So there's ways that you can help and amplify that. And of course, all of the funds raised through those sales will go back to providing more after bags that we'll distribute through our networks as well. Yeah. Um, Questions. I know you're busy with mental health first aid training. Would you be able to coming to a workplace and talking about this project and how people can get involved? Or would you prefer us to share the link to the website or the webinar? I will. I think everyone on the line here will know that I will go and talk to anyone anywhere about mental health. I'm looking at Matt. We're in the same room. Yes, so very happy to do that. We'd love to come and share the idea behind the AfterBAGS concept. We do lots of workshops and we do lots of sort of lunch and learn sessions as well. So yes, very happy to do that. I know some of my clients already that I've shared the idea with that invited me in to talk to their teams about this project from a learning perspective. And there's a whole range of sort of things we can do after that as well. But yes, very happy to talk about that sort of opportunity and how we can support your teams in any way that we possibly can. Yeah, very keen to do that. Very keen to do that. So thanks, folks. The chat box has gone fairly quiet. I just want to say thank you for coming along to today's session. This is a project that we've been working on for over a year now, and we're so proud of it. We're so proud of it. And I have met in the last week alone, 3 people who have lost someone to suicide in the last fortnight. And they have been the lucky recipients of a after bag. And when we hand that bag to people and they look at the items and they read about why they're there and they feel them and they use the lip balm and they do all those things, the relief and the appreciation and the empathy that they feel is visible. You know, we've seen it. We know what it does when we hand the product over to somebody, and we just can't wait to hear every story of how that happens around the country and beyond. So, yeah, and my deepest thank you for coming along to today's session. Of course, we are available if you've got any questions or anything like that after the session. Feel free to reach out. You can get back in touch with me via the AfterBAGS website or the Mental Health Coach website, or just email me, give me a call. I'm very happy to talk to you. Would love to talk about any ideas you might have and how we can support you and your communities. We'll stay on the line in case anyone has any questions. But for now, I'll stop the recording and we'll go from there. But thank you for putting time aside and being here today with us to launch AfterBAGS Australia to the world. Thanks, Matt. Thanks, Kat.